So Xealth is a company that saw a problem in the industry where digital therapeutics is something that's becoming more and more popular, and patients are looking and needing to have care outside of the four walls of the hospital. And at current state, ordering and prescribing and integrating digital therapeutics we found as a problem for a lot of health systems and IT companies. So Xealth was born and spun out of Providence to help solve that issue. Xealth is a SMART-on-FHIR app that embeds directly into Epic and Cerner, allows physicians to be able to prescribe digital therapeutics to patients who then can consume it directly from their patient portal. So creating one seamless environment for both clinicians and providers to better digitally engage and take care of patients outside of the four walls of the hospital. So as you can see here from our demo environment, Xealth embeds, again, directly into the EHR, whether it's Epic or Cerner, creating one seamless location for clinicians to be able to prescribe digital therapeutics. And that can be anything from a video, education content, to third-party application that we integrate directly into the EHR. What we're seeing here is our environment that is embedded into the EHR, and you're having applications, content, videos recommended to the clinician based off of data that we're gathering from the patient. So again, SMART-on-FHIR app that lives inside of the EHR, we're gathering data to understand what is the patient here for, where are they in their healthcare journey, and what should we recommend to them for their care outside of the hospital. So in this example, we have a patient that has come in and they have depression, and they also may need a remote patient monitoring device. So within the EHR, we're able to go in and directly order that from the SMART-on-FHIR application. In this situation, we're checking to make sure that the patient is receiving the correct remote patient monitoring devices. So maybe the patient in this scenario only needs a pulse ox and they only need a thermometer. From here, we'll click those two devices, submit, and all of this data is then being sent to the remote patient monitoring device. So the health system itself is not having to do that integration. It's all done through the Xealth platform. And from that standpoint, after that is ordered, it's sent directly to the patient through an email or SMS to alert them that something has been sent to them through their patient portal. The patient can then log in directly to their patient portal and engage with that content that was sent to them. The full round trip of this is once the patient is engaging with that device or that content or that video, the clinician is then able to see within the EHR the patient's data and their progress in their content journey. So from the monitor tab, we're then able to see, did the patient watch that video? Did they open that PDF? And if it happens to be a third-party application that we've integrated in this scenario, the remote patient monitoring device, we're actually able to open the dashboard directly from this view and engage with that content, with that data, and understand where is the patient in their journey. Are they taking the amount of steps that they need to? Where is their pulse ox rating? And that data is all available to the clinician inside of the EHR. They don't have to go out to a third party. They don't have to look at different apps. It's all in one central location for the provider. And this data can then be transposed back into the EHR if necessary. We help write it back discreetly if we need to, but if it happens to be something that just needs to be a dashboard view, it's all there ready for the clinician to see. To learn more about the Xealth platform and the 25 health systems we're working with, visit Xealth.com. We look forward to hearing from you.